Good evening, everyone. I am so excited for you all to be joining us on Martin Luther King Jr. evening as we discuss a human rights crisis, Black maternal health. I am so excited to have our expert panel of guests, which I will explain. But first, I am going to start with a famous quote by Martin Luther King Jr. So, of all the forms of inequality, injustice in health is the most shocking and the most inhuman because it often results in physical death. This quote is so important for the discussion that we are going to have tonight. So, I am Dr. Chalice Rhodes. Welcome to Talk the Wellness Tea with Dr. Chalice Rhodes. I'm a licensed professional counselor, national certified counselor, and a board certified telemental health counselor. I specialize in all things health. So, mental health, physical health, spiritual health, they are all so important. And so I also specialize in health equity and health disparities and diversity, equity, and inclusion and belonging training. And so tonight we are here to talk about the Black mental health crisis. So we first have up Kyra Gill, who is a licensed associate counselor, site supervisor, and clinician of the START program, the Center for Great Expectations. We have Unique Cologne, who is a mother and who has her an associate's degree, an associate's of science degree in psychology. And last but not least, we have Jay Wilson, who is a licensed practical nurse and founding president and CEO of Melanated Moms. Welcome, ladies.
Thank you so much.
Thanks for having me.
Yes.
Thank you.
Thank you all so much for volunteering your time on MLK Junior Day. I think we'll start with Kyra. So why don't we have you all introduce yourselves and tell us a little bit about your background?
Yes, of course. So my name is Kyra Gill. I am an early relational health clinician as well as a licensed associate counselor. I primarily work in Essex, Union, Hudson, State counties, working with women who have history of substance use disorder, mental health diagnosis, who are pregnant, parenting, in their postpartum journey. I have learned that a lot of times these women don't have advocates in these health spaces. So although I've only been in this specific area for 5 years, I have learned so much and have experienced so much. And I really have learned that a lot of times as a provider, you have to advocate for the women that you are supporting.
Thank you so much, Kyra. Unique.
Hello, my name is Unique Cologne, and I do have a background in psychology. And during my studies, we actually highlighted the crisis that's currently going on. And then I eventually got pregnant and became a mother and became part of the statistics. So during this journey, it definitely taught me that this is a topic that needs to be highlighted, and that needs to be discussed and talked about. And during this journey, it's just taught me so much. And I was able to get resources to help other women and advocate for other women who are also going through this or going to experience this.
Thank you so much, Unique. Jay.
Hi, everybody. So glad to be here. My name is Jay Wilson. I'm the founding president and CEO of Melanated Moms. My organization has been around for 6 years. We do maternal health equity work where we provide moms, women, and birthing people with the support that they need to become better versions of themselves. Outside of my organization, I am also a nurse. I've been a nurse for over 20 years. Primarily working in the LGBT community and with different areas of marginalization and understanding how being marginalized can impact your health and well-being and the decisions that you make around it. Personally, I am also a mother. I'm a mom of 2 girls. My girls are 15 and 12. They are both bigger than me. But I am also a 4-time survivor of preeclampsia and understanding how my journey to motherhood was very, very tumultuous. And I had to learn how to become an advocate even before I knew that's what I was doing. So I'm really excited to be here and really share more about my experiences and how it also intersects with what we're talking about today. Thank you.
Oh, thank you so much, Jay. And talking about the Black maternal health crisis, Unique, how did you start with sharing your journey? How did you become a statistic?
So when I got pregnant, I went through Cooper Hospital, and I had a really good gynecologist. I felt really supported during that journey. It was until I got diagnosed with preeclampsia. So yeah, so during that journey, that's when things kind of got tumultuous. And I wouldn't say like when I was pregnant, it was really a lot going on as far as feeling neglected and not heard. I would say it's primarily during giving birth that I was really starting to see that I wasn't being heard and I wasn't seen at all. So when I went to give birth to my child, the nurse that I had in particular, I was letting her know that, you know, I'm cramping really bad and I think that my water broke. And she's like, no, it's not that. It's probably, you know, just something else going on. And I was just telling her like, look, I'm really in pain. And I really, really need to be seen. I need the doctor to come just check. And, you know, from the time that I walked in, I kind of could feel like her energy. And I don't know whether it was like, you know, she was at the end of her shift, but I really, really, really felt unheard, unseen. And it was definitely a scary situation. So when the doctor came in, my water did in fact break. So yeah, so it did break. So, you know, that was kind of swept under the rug. And then during that time, I went ahead, I gave birth. And then a couple of days after being home, I just started to bleed everywhere. Yeah, so I bled out completely. I had to get rushed to the hospital. And turns out that they forgot to take out my placenta and my stitches broke. And I almost lost my life. Like they were having conversations with my child's father saying that we don't know how it's gonna look, but you can only imagine how much pain I was in. I just couldn't believe that I was actually really experiencing this firsthand. And now that I look back at it, you know, when I was given my epidural, even that was like, you know, a complication with that. I still felt my legs and my feet after getting the epidural. But one thing I can point out is that I wasn't given consent to have people who were practicing, you know, operate on me, especially since it was my first time giving birth. So looking back at it, I do know that they had students that were observing the doctor.
Okay.
And yeah, so it was definitely students that were doing the stitches. It was a student under the supervision of a doctor that was giving me my epidural. And it was just chaos. And looking back at it, I'm thankful to be alive.
Yeah.
But it was definitely a humbling experience. It was really, really mind-blowing. It was completely mind-blowing.
Oh my goodness, that sounds so scary. And in
It was
terms of,
so scary.
yeah, like how are you feeling in terms of, because physically you were saying about the physical pain, but the mental health piece of it, you know, mental health and physical health go hand in hand. What was that like for you?
Yeah, those two are definitely correlated. So I feel like I was traumatized twice because, like I said, this is my first time giving birth. So
Yeah,
that experience within itself is already traumatizing, right? Like for some women, like I was scared. Anybody who's
yeah,
it's their first time, you don't know what to anticipate.
yeah.
So that within itself was already traumatizing. The experience that I had with the nurses and the doctor, it was already traumatizing me, like the first go around.
Yeah.
So now I'm putting myself back in a situation, whereas I have to come back to the people who already dropped the ball. And I remember just begging the doctor, telling him undergoing anesthesia, I'm like, please don't let me die. Please don't let me die. He's like, you can trust us. I'm like, are you sure? Right? Are you sure? So in an aspect of my mental health, I've been completely traumatized to the point where me even giving birth to another child, I have a little bit of trauma there. I'm afraid to again. I don't know if I'll make it out this time if I get pregnant again. So that's definitely something that has traumatized me. I have PTSD from, and I'm starting to slowly but surely overcome that. My little one is 4 years old, thank God. But I'm slowly but surely coming out of that situation. Whereas like I have this fear of giving birth again. But directly afterwards, coming home, I was scared to go to the bathroom
Oh,
because I
yeah.
thought that my stitches would bust.
Oh, yes.
I was scared to do anything. I was scared to bend down. I was literally traumatized, and all I could think about in my head is just reliving those moments of the blood rushing out and feeling woozy and almost passing out. If my child's father wasn't there, I don't know. I really can't say what would have happened.
Oh my goodness.
I really can't say.
Let me ask you, Unique, were you offered any type of counseling after having your baby?
Absolutely not. So I was not offered any type of counseling after that situation. I went ahead and got counseling on my own, you
Good for
know?
you.
Yeah, so I went ahead and got counseling on my own just to help me overcome, you know, the trials and the tribulations of it all.
Yeah.
But it was definitely, like I said, a very eye-opening experience because it could be you. And all of us sitting here in our seats, you're like, it could never be me. It can be you. 100% it can be you, because it was literally me. And I was just thinking to myself, wow, I studied this already. Like, I remember being in class and doing research on the maternal health crisis and how, you know, it's a disproportionate amount of Black women dying or having really tumultuous experiences giving birth. And a couple of years later, I'm in the same situation. So it was definitely traumatizing, definitely really scary.
Yes. Thank you, Unique, so
Of
much for
course.
sharing your story. I mean, there's countless women who have gone through this. Jay, if you can chime in here and maybe share your story as well. Now, what's interesting is that Unique mentioned preeclampsia, and then Jay, you mentioned preeclampsia.
Yeah. First of all, thank you for sharing, because I think when we're in these spaces, it is healing to share these things out loud, but it does make you relive those things. So you did speak about PTSD, and even for myself, I know that sometimes it can be very daunting to relive the story because you literally lived through it, you know?
Yeah.
I know for me, my pregnancy with all of my kids, but my pregnancy before I had my oldest daughter, it ended in a stillbirth. I was actually on the city train coming home from work, and my water broke. I didn't know my water had broke. I just felt wet. And I remember just being scared because I was only 6 months pregnant. And while I'm standing there and I'm like, something happened, everyone is on the train, all seeing me freak out. No one said anything. No one did anything. No one offered any help or support. No one moved. So I'm frozen. I'm just like, what's happening? I don't know what to do. So I had to take it upon myself to be my own savior in that moment, right? So I went to go for help. The train station had a police station, and I went into the police station to ask for help. And they're looking at me like I'm a suspect. What do you need? What are you doing? Why are you in here? You know, and I'm just wondering, where is the care going to come in? Where is the opportunity for empathy to ask, do you need anything? Are you okay? Are you safe? Is there anything that we can help you with, instead of an accusatory tone, right? I went through that experience, and just, again, being on a city train, not understanding what was happening in the moment, and then everyone yelling at me and all these very traumatic things happening. I ended up being in a hospital for a week. My baby passed away. I just didn't understand why these things were happening to me. And I had the education, I had the know-how, I knew how to ask the questions. This was, this is where I've created a profession, but I'm still being ignored. I'm still being dismissed. And now I'm here with a baby that I literally cannot take home, So when we went to try again, and I got pregnant with my now oldest daughter, I was fearful. I didn't want to get on the train. I didn't want to go anywhere by myself. I was like just incredibly fearful of every move that I made. And while I'm expressing these things to my doctor, they're dismissive. They're like, oh, well, miscarriages happen, losses happen. And I'm like, yeah, well, it didn't happen to you. It happened to me. And my baby matters. And I never want to feel like, because she's not here, that her life didn't count. And I want to make sure that this baby that I am carrying actually makes it here. So I'm asking for your support, because you're my provider, and I think what we have to do, when we have to be more vigilant for ourselves and for, our everyone who's out here, to let them know, like, your voice is absolutely what's necessary. If your provider is being dismissive or trying to gaslight you or making you feel bad for asking for the help or support that you need, you change providers. You create the safety that you need in order to trust the systems that you're in, and in this work and understanding that all of these experiences that I've gone through with my pregnancies, I had no idea this was setting me up for the work that I do now. I just thought these were nuanced things that happened to me until I started to speak out and speak up. So I'm grateful for spaces like this where we can have these candid conversations, but we also can learn from what happened to us and give more knowledge to those who will need it. Even if you never experienced a stillbirth or another birthing accident ever, that's the goal. But to always be informed and equipped with the right knowledge so that you can ask the questions, so that you can look out for what's going on with your body or with your baby, that's what we need to continue to push.
Yeah, and Jay, I just extend, my heart goes out to you. As I've told you before, losing a baby, I can't even imagine. And, the fact that you turned your pain into purpose and created melanated moms that are impacting so many moms and all of the great work that you're doing, we are so grateful for you.
Thank you so much. Thank you.
Yes.
And Jay, you mentioned something throughout your experience about how you wanted your baby to matter. And I think so much in the medical space that miscarriages, infant loss isn't harped on enough, and there's not enough support provided. Especially as women, we're taught that our bodies are meant to reproduce. And when we're not able to do that, what internally goes on, right? Are we feeling like our bodies have failed us? And there's not enough trauma-attuned care when it comes to providers in this space to provide support to birthing people. And I also want to harp on the fact that you were such a strong advocate for yourself. You knew what you deserved and you made sure you found it. A lot of times I mention to women that if they feel they are not getting the services or care that they feel they deserve, they can file a grievance against that provider. They can go to their higher ups. They need to do what they need to do to ensure that they are in a safe space. That is our human right.
Absolutely.
Yes. I love that. And when you all talk about that, when we talk about the mental health piece of that, of challenging a healthcare professional, right, who we view as an authority figure, there's that piece where women experience anxiety with that piece, because even when they have spoken up, sometimes they're still dismissed by the healthcare provider. And some don't feel empowered enough to just change providers, or maybe because of the situation. But I'm so happy that you guys are bringing that up, because that is an important point. You have a choice. As Marnie shared in the chat, and feel free to share in the chat, Marnie said the doctors work for us.
That's it.
Marnie, I agree. And Marnie, if you want to come on camera and share your thoughts, you can as well. But in the chat, Marnie is sharing the doctors, they work for us. And you do have to speak up. And sometimes it's hard. Sometimes you need that support person to kind of help push you. Sometimes your mind is so bogged down with anxiety, and anxiety can present racing thoughts. Your body could be shaking. You could just not have your thoughts together to even think, to even have the wherewithal to actually advocate for yourself. So even if you can advocate for yourself, if you have an advocate in a room or someone you can call to help you, try to do that as well.
And I think,
sorry,
go ahead, Jay. Go ahead, Jay.
Oh, no, I was going to say, I know, like, during my pregnancies, the first thing I asked for was a doula. And they told me, and this is misinformation, they told me, well, you're a high-risk pregnancy. Doulas don't do high-risk pregnancies. And my kids, again, they're 15 and 12. I'm not excusing it at all, but I think the fact that there's still people now, even as popular and aware that people are about doulas, there are people that still are so misinformed and miseducated about the benefits and the purpose of doulas in any birthing situation. For me, my anxiety, and like we were just talking about, those things were so high. I was so afraid. Instead of the doctor, understanding what a doula could do, they actually gave me another nurse. They're like, we'll get you home care, and the nurse will come and check on you every single day. and it may have helped them like clinically, but like that's not what I needed. I didn't need another clinician to tell me what I needed to do. I needed emotional support. I needed someone who understood all of these things that have happened to me prior that brought me to this space, right? So my nurse was great, but I don't think that she was in the space of understanding what her purpose was in my pregnancy, for it to have been a beneficial resource. You understand? So I think, again, like, we have to have these conversations, but also we need to call in these clinicians who are a part of these birthing experiences, because even if it's not their intention, they're causing a lot of harm, or they can be causing a lot of mistrust just because they're not listening. When we talk about Black maternal health as a crisis, it's a crisis because people are literally not listening to these women who understand what's going on with their body, or who may say, I'm not sure what it is, but something is wrong. There are so many countless stories of women who have had morbidity or mortality who started with that particular phrase of, I don't know what it is, but something is wrong. It was ignored, dismissed, or completely sent away.
Yes, and to add to that, Jay, thank you so much for sharing that, because the distrust in the health system, it runs so deep in the Black community. Okay. We could trace it all the way back to slavery and to all of the injustice that has been done, all of the experiments, Henrietta Lacks, the Tuskegee experiments, that has caused this distrust in the healthcare system. And you're right, healthcare professionals need to be educated. I actually do training healthcare professionals in motivational interviewing. So basically training them how to have empathy with clients, because that's what you're talking about, Jay. When you were talking, no one was really showing empathy, which empathy is different from sympathy. Empathy is not sympathy. Empathy is trying the very best that you can do to put yourself in someone else's shoes. So as a healthcare professional, imagining themselves as this woman delivering a baby and what she might be going through, she's telling you that she's experiencing pain. So many times healthcare providers, they're on a schedule. They have this patient, they have that patient. And motivational interviewing helps them collect information in an empathic way, still in an effective way, but also in an empathic way. So doulas, Jay, is the purpose of a doula, because you're right, we don't hear a lot about doulas. I don't know a lot about doulas. Is the purpose of a doula to experience or to provide emotional support for the mother?
Yes. So doulas are non-clinical partners that will help the birthing person and their family, their support system, to understand what the birthing experience looks like, how to advocate for the things that they need while they're in that space, and also really giving them those key indicators of understanding when they feel something's not right. May not just be physical, might be mental, it might be emotional, might be in that room with those providers, or in that healthcare space, how to advocate for themselves. So whether or not they are there in the room with them or not, they are equipped with the tools that they need to be a more informed birthing person. Doulas serve throughout a pregnancy. They also serve families postpartumly, where they're providing that additional support, right? Because we always think about, you got to get through the pregnancy, yes, but after that baby gets here, the whole world turns upside down, right? This is a complete different change of life, of what does it look like to go from a person to a mom or a dad or a parent, right? But having that additional support as you transition into that role is super critical. They also help to identify postpartum depression, not as a diagnostic tool, but help to ask those questions of the family. They increase breastfeeding. They reduce C-section rates. They're very evidence-based, but they're also rooted in holistic practice. So doulas have been around for literally eons, but what we're seeing now is different states, New Jersey is definitely one of them, but different states who are understanding how to embrace what doulas bring to the table and to increase the capacity of how they are able to serve as an integrated partner instead of a competitor. Because previously, if doulas were coming into a birthing situation, they were met with hostility, or they weren't always as welcomed. Oh yeah, absolutely.
Yeah.
Because the clinicians are not looking at them as another clinician. They're looking at them as a liability, you know? So when we're understanding how to use these tools, or how to use people as the tool that we need, so that we're better, we're more informed, we're more open to what's happening, then people, their bodies are able to naturally do what it needs to do. Even if a C-section does need to happen, they are informed about what's happening, how to prevent infection, how to make sure that they're not doing things to burst their stitches, or, how to even ask for help if something happens and they do need to go back to the hospital. Doulas are an amazing resource, and I'm so glad to see that more and more states are not just accepting them, but they're now being covered by Medicaid, which supports more than 50% of the births across the country. So understanding like that is such a critical piece for us to turn this maternal mortality crisis into actually maternal vitality.
Yes, thank you so much, Jay, for sharing that, guys. And I'm just going to interrupt here. Our panel of experts are going to actually take over the discussion, guys. I have to attend to my firstborn son. We're having a snowstorm here. So his job is actually closing early. So I'm going to go and pick up my son. I'm going to turn over the discussion to our excellent panel of experts. I do just want to say one thing before I turn it over. Speaking of doulas in a process, Jay, thank you so much for explaining that. As a mental health professional, and I know, Kyra, you're a mental health professional. We have Tomorrow Pilgrim, who is in our chat. Tomorrow, please feel free to get on camera and share if you would like. You guys can use the raise hand feature. She is also a therapist. We're, along this, it almost seems like it would be a step model. I wonder where behavioral health therapists can come into the picture. So would the doula maybe alert the family, hey, have you ever thought about seeing this therapist? Having more therapists that actually specialize in the Black maternal health crisis, right? Not that you need to specialize in it, but it would help. So if you guys can continue the discussion from there, and then I'm just going to exit off camera and I'll be back shortly.
Thank you.
Thank you.
Right, so I actually really resonated with the doula talk. I am blessed to work on a team of 3 women, one of them being a doula. So she is there as soon as mom joins us, and she creates a birth plan, and she is with mom. We like to say she is mothering the mother. We love our doulas. We encourage mom to be in contact with her the most. She is checking in with mom on not only the baby, but herself. A lot of times we see providers are focusing on just the infant, but they're neglecting mom and her as her own individual person. They're just seeing it mom and baby. They're just acknowledging the dyad, not that they're 2 individuals. So we really appreciate the doula work. I am excited as a therapist that I am able to work with a doula that is keeping me in the loop with mom if she's seeing any of those flags for postpartum depression or any other sort of mental health diagnosis. And also, I'm thrilled that, at least in my area, doulas are becoming more welcomed into the birthing space. In a lot of hospitals in my area, Northern Jersey, birth workers are allowed to come. It was a very long fight, but a lot of our moms now are able to have their doulas on site as they're giving birth. They allow them to have not only their 2, let's say, support partners, but also that additional person be the doula.
Nice.
I was actually fortunate enough to have a doula. So I forgot to mention that to you guys. I'm like, I should have mentioned that. So I actually did have a doula, and you guys definitely do a great job as far as explaining what the purpose is of a doula. So when I first got introduced to my doula, we kind of just went over a birth plan. She was really supportive of me during my journey. Just a lot of communication, a lot of comfort that she provided for me. But, during my journey of actually giving birth, she came in with her essential oils, some of my favorite scents to relax me. Because I'm telling you guys, I was really panicking. I was really, really having just like a rush of emotions. So she really did do a efficient job at providing me comfort in that moment, and definitely just giving me the comfort. She came in with the essential oils, a diffuser. She was just letting me know that the process is going to go well. I did have a goal of not using a epidural, so I was really aiming to have a natural birth. But when she seen me suffering, she was like, it's okay. Like, don't put too much on yourself. It's okay to go ahead and get the epidural. Like, it's okay. You're in a lot of pain. You're putting yourself through a lot of pain. And although I was disappointed that I wasn't really able to achieve my goal at giving a natural birth, I'm just so happy that I had that support there, as far as holistical, and her being there to support me emotionally and having empathy for me, and, looking over the doctors. And she was actually there to help me switch out my nurse. Because when I first came, I told you my nurse I just didn't really feel supported. Like you said before, during your experience, you felt like the nurse or the doctor was really just dismissing your feelings. Right. And from the moment I walked in, I just felt a lack of compassion, a lack of empathy. I didn't feel heard. So I told my doula, and I communicated that with my doula, and she was actually able to have a conversation with the attending physician and get my nurse switched out. So that was definitely a plus. And I would advocate for anybody, if you have the resources, do the research, get the doula, because she made my process a lot easier.
Yeah, no, I do. I feel like doulas are such a wealth of information. And because they're not clinicians, they're not in that space of feeling that they have to be like rigid, or they have to, this is the procedure, right? They're understanding what you're feeling. They're helping you to trust your body. They're not putting in all of that doubt, right? So you may have a nurse who's like, well, you're about to have a baby. It's going to kick your butt. You need to take this medicine. You need to do this. You need to do that. And that's going to give you more anxiety, right? Whereas your doula is saying, whatever decision that you need to make for you, I'm here to support it, right? So you're learning how to trust them. You're also learning how to trust yourself. And you're also not feeling bogged down with, I have to do this or I failed, or I have to do this or, something terrible is going to happen. It's really understanding that birth is an experience. It's not a procedure, right? So I think, like, as we're talking more about doulas being supportive, learning about advocacy, I definitely would love to share one of the things that we love to do. I actually wrote a book called Find Your Roar, which we turned into an advocacy training. And we've been training people for the last 3 years so that they can understand the power of your voice is really what creates the changes that we're talking about, right? Originally, we just started as a Melanated Moms in Itself. She started as a small mommy meetup group, but when we implemented Find Your Roar, it was really to help moms to learn how to find their voices, right? When you're a mom and you're learning all these things of standing up for your kid, or creating voices, space where your kid is going to be seen and valued, you are advocating, right? But when I was approached about, like, hey, do you have something that we can teach parents to use? I was like, oh yeah, we have, this great curriculum. And in these last 3 years, we've been able to train over 3,000 people. And those people have gone on to, it's crazy, right? But those people have gone on to do PSAs. They've gone on to do hearings and testimonies for state government. We've also been able to work with the Black Maternal Health Caucus in Washington, D.C., and really learn more about how do we continue to push this forward, right? We have some amazing partnerships with different organizations. I know Marnie is here from Push for Empowered Pregnancy, where we talk, like, very candidly about having legislation or public policies that match what it is that we're asking for, right? So I'm not just telling you I want support. I'm not just saying how it's nice to help contribute to reducing maternal mortality, but I'm also asking for legislation or public policies to back what it is that we're asking. Because what we're asking for, as the whole title of today is, these are human rights. There should not be a mom or a birthing person that walks into a hospital, a birthing facility, or wherever it is that they birth and feel like their top 10, 1 out of 5 experience is, it's a 5 because they survived. Right? We want our moms and our families to feel comfortable wherever they're going. And we want the clinicians the entire team that's a part of that birthing experience to be included, but not as, someone who is an adversary, but someone who's really going to be an advocate with them. So as we're talking and as we're learning more about what does it look like to advocate and to really like sharpen our voices, I always want to mention how Find Your Roar has been such a revolutionary way for us to do that.
That's awesome. We do have a question in the chat, and I think it would be interesting for Unique and Jay to provide your perspective based on your experiences you shared today. What do you do if your doctor isn't listening to you?
Yeah.
I feel like if you're not being heard by your doctor, I think there are different resources that you can do to talk to somebody else. So you can therefore report them. I know that there's 1-800 numbers that you can report them and let them know like, this is my experience. I personally wouldn't go to like another attending physician that's within that company. I would definitely seek out like a HR number and definitely get them on the line and let them know like, hey, this is my life that we're talking about, and this is what I'm experiencing. I find that would definitely be an efficient way at advocating for yourself, or you can even change providers, like you mentioned earlier, and, do it that way just to fill out somebody else. And, when you find somebody that is allowing you to feel heard and seen, then that's when you go with it. But I would definitely recommend reaching out to somebody that's a little bit higher than the attending physician if you're feeling unheard.
Yeah, I definitely would second that, support that that statement. I also would take notes. Like when we're going into these appointments, if you're not comfortable with like a pen and paper, take your phone out and open up your notes and really jot down like what are your experiences. One, so that you're clear and concise. Two, so that you know what it is that you are experiencing so that you can address it fully. And three, just so you have a record, because sometimes it might be you just having a bad day, and I'll give that to anybody. But if you're noticing a pattern of asking for the same resource or seeing the same types of dismissal when you bring up questions, then those are definitely when you want to bring in a different provider, you want to create a complaint or a grievance, right? Even finding out what is your hospital's policies on that, right? I remember having a mom who was having very similar circumstances at a prenatal appointment. And I told her, I said, ask for the hospital's ombudsman. And she's like, what is that? I was like, I bet you don't know who it is when you ask. And it was like she set off a fire alarm, right? So it's not to, set the place on fire, but it's so that they know that you are actually equipped with way more knowledge than they want to give you credit for. And it's not giving them a space of thinking that you're being combative, but you are informed. Right. And again, as Marnie said in the chat, like the providers are working with us. Right. So you work for us as our provider, but you definitely can be fired. You deserve and you should not have to feel that whatever care that someone gives you is just what you have to accept. This is your life and it's also your baby's life. Right. And there are providers who may not be aware, implicit bias, right? They may not be aware that this is how they're presenting themselves, but it's also providers that may have never had anyone give them this feedback. So they think that they are operating in a space that is totally fine because no one's ever checked them, right? So I totally agree.
Thank you so much, Unique and Jay. And I think with that as well, when you have those positive experiences, spreading it in the community, so that way you're sharing other great resources with other birthing people. And then there was another question in the chat from Marnie. Do you request that your doctor records your concerns as well in your medical records and record if you are denied a test or treatment? Similar to what Jay said, keep a record. Anytime I am working with a mom who is encountering a difficult provider, I'm taking my notes for her and I'm encouraging her, like Jay said, to jot things down as she's with her provider. That is your right. Providers sometimes don't give you all the information that they should be at your appointment. So I always try to schedule my sessions with moms after they meet with their providers to see what they went over. Did they ask you about this? Did they ask, oh, what are your plans for the next 2 weeks? Like things like that. Just so mom knows what should be asked during appointments too. I find that a lot of times they're like, oh, they just checked the baby's heartbeat. They didn't ask me anything. I was in and out. They're just happy to be in and out. They don't realize that can sometimes be neglectful.
No,
Yes.
absolutely.
Absolutely. Yeah, I definitely experienced that. When I was going through my journey of being pregnant, I was getting really bad Braxton Hicks. And at the time I was still working. I would say I was like towards the end of my 3rd trimester. And I remember saying to myself, like, I'm going to have this baby. I'm going to have it. But I'm a first time mom. So I didn't know that Braxton Hicks kind of feel as though you're having like, contractions. So it was my first go around. And I remember going up to the doctor's office and I'm just letting her know, like, look, I've been having these Braxton Hicks. My feet are swollen. I'm working like a dog at my job. I was a bank teller at that time, like standing on my feet for 8 hours. And I was just letting her know, like, maybe I'm getting to the space whereas, I feel like I might have to take off from work early just to really focus on, my health and making sure that I'm taking care of myself and taking time to rest, before I give birth. And I will never forget, she sat there and she looked at me and she's like, you're acting like being pregnant is an illness. It's not an illness. You can still go to work. And I'm like sitting there with like cankles.
Yeah.
Towards the end of your pregnancy, you really start to slow down. You really start to feel the effects and the changes on your body. You start to become, just really, really exhausted, heavier. And then I also suffer from preeclampsia. So it was just a lot of other things going on with my health. And I felt like it would be, in my best, it would be a better decision to take off from work, because I had a strenuous job. I was lifting coins on my feet and my feet were so swollen. It was so painful for me to walk. Getting out of the bed was just a hassle. And I just remember really sitting in that doctor's office and she looked me dead in my eyes and she's like, it's not an illness. Like, in other words, I felt like she was saying, suck it up.
Yeah.
Suck it up. And I felt shattered and I felt this small, And at that time, I really didn't have the capacity to advocate for myself, unfortunately, So I kind of I took that, I digested that, I internalized that. And I'm like, you know what, maybe I am causing a fuss. Maybe I should push myself. But I do really remember feeling really devastated. And just the way she said it was so condescending. She was just like, deal with it. You're fine. And you're having breakfast. You're able to go home. You're not. I just felt like she was really dismissive. And it was my first go around. Right. So although I know it's been experience after experience with her, just telling people how to give birth in certain situations, it's my first time. It's her 1,000th time, my first time. So that ties into like just them not having compassion and empathy. So that was also another troubling experience that I had with a provider.
Yeah, I think it sucks. And I'm sorry that you went through that as well. I really think it's terrible when you hear providers who are speaking to people in that manner and who are treating you as just a statistic, right? And, as we found out, we end up being statistics in one way or another, right? But for her to be, and I'm just assuming it was a female doctor, but for her to be so dismissive in that space, knowing that you're preeclamptic, also seeing the physical signs of what's going on, even if her response in terms of like not taking off work was the same, again, her having the empathy of understanding that you are experiencing something that is outside of yourself. This is not how you regularly live your life every single day. Help me understand what changes are happening in my body. If you can't take me off of work, what are some strategies that I can use to relieve this pain or this discomfort or the swelling in your legs, right? She could have given you compression stockings. If she decided, you know what, I don't think you coming out of work would actually help, but if you have to stand on your feet, these compression stockings may help to, recirculate things and reduce the swelling in your legs. Or if you're noticing that the swelling in your legs is happening this amount of time, document it, see how long it's lasting. Are you pressing down on your legs or your ankles? Is it pitting? Other signs that will help you understand if this is an indicator of I need to go to the hospital, or is it just a circumstantial time and place of being discomfort, or being in discomfort. You understand? So
Yes.
it's very difficult, again, like what we were saying earlier, of understanding that these are the reasons that people feel distrust in these systems. So when we see more moms, and I know for me, the biggest telltale sign was actually during the pandemic, when everyone was afraid to go to the hospital because of COVID. The most afraid person by far was the pregnant person. So there was a huge shift of women who wanted to go from, okay, I already have my birth plan here in the hospital, to saying, I think I need to go to a birthing center because I'll have less risk of catching COVID. But then you saw the opposite effect happen, where birthing centers were turning them away and saying, well, you should have planned with me before. You better go to the hospital. And again, creating more anxiety, creating more uncertainty, creating more spaces where now they have to go into this place where they already don't trust them. They already feel scared. And there's this deadly virus that they have no idea how it's going to impact them, right? So we have to do our due diligence to have these conversations, but to also like put this stuff in front of these clinicians who are making these decisions, who are continuing to cause potential harm, and helping it to become a learning space, right? So again, not being accusatory, but being very aware of like, how do I create an integrated relationship with you if you don't even trust me with myself? If you don't even trust me as a part of the experience that I'm having, because you're throwing statistics at me about people who have died or people who have had or morbidity rates, but I'm living here in front of you, right? I'm a living, breathing person who's carrying a baby, and I need you to help me to get to the finish line, not just barely crawling, but like really feel supported in this journey, It makes me think about this really great resource. Have you guys ever heard of the Earth app?
No.
Either?
Oh.
Ooh, yes. So one of my wonderful mentors, Kimberly Seals Ehlers, is the founder of the Earth app, IRTH. She drops the B for the B in birth, but the B stands for bias. But the Earth app is a Yelp-like review where moms, birthing people, doulas, midwives, clinicians can actually leave their experiences with going into these systems and really talking about these things that we're experiencing with distrust or dismissal. There are even women or birthing people who are threatened and saying, if you don't take this shot, or if you don't do this epidural, or if you're not doing this, then we'll call child protection, or we'll do all these other because you're not compliant, right? So having that as a resource, it literally is changing the way that we see what equity really looks like, because it's coming from the birthing person themselves, right? So again, going back to these statistics, we're learning from people who have already passed. We're learning that, I think the statistic for COVID, more than 80% of the mortality rates was preventable. So you're telling me 80% out of 100 people, 80 of those people could have actually survived, but you decided to dismiss them, deny them, or completely eliminate their concerns, and now they're not here. But you can learn from their death, but you can't learn from the living. So that's why I always talk about this app, because it is learning from the living. It's understanding how to create the documentation that we need so that we can go back to these systems and say, hey, Jane Doe came into your hospital on this date. She was served by this provider. Here's her experience. Here are the things that she experienced with the provider, with the nurse, with the floor. Here's the family's experiences. And you can be as brief or as detailed as you need. But those are the testimonies that we need to know we're not crazy. We're not making these things up. These aren't nuanced or isolated incidences. There are thousands of reviews from all over the country where women are talking about their experiences, and they're literally saying, finally, somebody hears me. And it's in a space that you can't deny, you can't buy, and you cannot erase. So we have to use this as like our due diligence of continuing to spread what kind of resources are out here for our voices to be heard, for us to continue to support one another, even just for us to ask those additional questions of what I don't know. So where can I go, or who can help me, find the support that I need. So I love talking about the Earth app.
Thank you for sharing that resource. I know I'm going to use it.
Oh yeah.
But it's also these spaces where we're able to talk about these experiences, and these resources are so important because it allows individuals to realize that their experiences shouldn't be normalized. Like they do need to make a fuss about it. It's not okay. And speaking out on it will hopefully prevent somebody else going through it, right? And Jay, you were talking about COVID, and I remember I was entering the birth field, right, during that time. And a lot of the women I worked with, they were terrified, like you said, to go into the hospital, to go into their OB's office. And when it was time to give birth, they were seen as neglectful. It was none of the other variables were taken into account. It was just, you didn't attend the appointment. We kind of don't care. We're going to have to do a CPS call because you weren't showing up. You're showing this, you're showing up this way. We prefer if you showed up the other way. And so that's what I think too, we need to talk about a lot, depending how the person's presenting, also affects how the provider perceives you, which isn't right as well. Yeah,
it's true.
Absolutely.
I see we have more comments in the what is this in the chat? I don't know why Tomorrow says, I'm newly certified. I hope to be of assistance. It was another question I just saw. Where'd it go? I'm sorry. Distrust. Dang it. Did I just make that up? I thought she had a question. My bad. Sorry, y'all. Don't want to come. Tomorrow says we don't want to come off too angry or unstable, so we quiet down, and quieting down we accept. Sounds like this doctor sucks. Yeah, it does, Marnie.
Yeah.
Oh, here's a question. I'm sorry. Tomorrow says, I'm not sure where you reside, but what do you suggest for us here in DE? So I'm assuming that's Delaware as far as advocacy is concerned. Oh, okay. Well, we answered it. Never mind. Okay. Anyone have any other questions? I think these are really great conversation points, but I think we can definitely, we can go down a rabbit hole. It really depends on how far we want to go, ladies.
We can definitely, because one thing I did realize and that I do understand is that pregnant people weren't giving birth in hospitals until like the 19th century. So I feel like there's not, like, this is kind of something that is new as far as women being pregnant and giving birth in hospitals. Like, I've researched and I know that the doctors used to come from the morgue and then go ahead and handle and help pregnant women give birth. And then due to that, there was a lot of deaths and just mishandling of pregnant women. So I feel like it definitely stems from just the history of just giving birth in general, and that not really being considered like an illness, So I feel like, in modern history, you would think that, they would get that together, but I think it does stem from something deeper, and even just women's rights in general and how they view women in general, having a male doctor and coming from the morgue and not cleaning your hands and not really understanding like the biological aspect of giving birth, So there was definitely just a lot of confusion and malpractice even back in the day. But as we see now, it's coming down the pipeline.
And I think that's what's really good with understanding why we need to know our history, so that we do have these reflective moments. And we also use that as leverage of saying, when we had these different areas of support, we can see where the evidence lies in terms of reducing mortality, in terms of reducing even, we didn't even talk about this yet, but maternal deserts, like maternal health deserts. So for some people who may not know that term, that refers to a space or, a geographical location where there's no hospital, birthing center, or even an OB to manage a person who is currently pregnant, right? In New Jersey, we have quite a few. But it's also understanding, like, how do people still navigate living in an area where they don't have access to care, or where the care that they do have access to is not the best, right? We have to remember that, like, it's not just a nuanced thing. Again, it's not a rural thing. It can be in the middle of, a metro city. But it's really like being aware of how much that does impact these statistics that we've been talking about this entire time, right? So if we're not aware, and I've done plenty of focus groups where we ask moms, what were some of the factors that went into the hospital or the birthing place that you chose, or even your medical provider. And, top 3 is usually location. Someone told me about this provider. This, I know someone who went to them, right? But then when we started asking more questions about what made you stay or what made it a positive experience, then it started to get really like, go left. They're like, oh, well, I say it was a 5 experience because I survived. Like, well, sis, you were supposed to. You weren't supposed to die, right? Neither was your baby. But to hear other women say that multiple times, or think like, well, what else are we supposed to do? There's nothing else. There's nowhere else to go, right? So I'm like, okay, we have to change this perspective of what it means to have adequate care, what it means to have quality care, what it means to say that the experience was not positive, right? How do we change the expectations? How do we, create different quality measures? Because it is not being experienced at the same rate for our non-POC counterparts, right? The statistics I know for New Jersey, Black women are 7 times more likely to die in childbirth as opposed to our white counterparts. And our children are 3.5 times more likely to die before their first birthday. When I heard that statistic, it threw me off, and it made me so upset because I am, again, a part of these statistics. I have a baby that I lost, right? But doing this work and talking to additional people who are all over this country, one of my really good friends is a senator in Tennessee, and Tennessee now has like the total abortion ban. Their maternal health is so scary there. And one of the things that she told me that like literally stopped me in my tracks is they have such a high infant mortality rate that they actually have a cemetery called Babyland. Could you imagine?
Oh, that is, oh.
There's a documentary on YouTube that talks about Babyland and how it's literally in the middle of Memphis, and this is a cemetery full of babies who were gone too soon. But no one is thinking that, seeing this and also being in this space, and again, maternal health desert, how all of these things are correlated, right? But it's victim blaming. It's, well, they should have did better, or they should have got better care, or they shouldn't have got pregnant at all. But you're taking away all of their rights. You're taking away all of their ability to obtain any type of reproductive support. And they're not getting the care that they need. So now, if they haven't passed away, now they have to bury their baby, But we're not having these conversations openly enough so that people know that these, again, are not just nuanced situations. These are happening all over the country. But it takes people like us who fortunately have been able to survive, and fortunately have been able to have conversations with women who are seeking the support to continue to survive through it, right? Because we can't change if we have been traumatized, but what we can do is keep these conversations open so that less people are continuing to be traumatized or continue to live with their trauma. And that's why it's so powerful to keep these connections and to understand how we can keep being involved, right? Just going back to our original statement, which is advocacy, right? Everything that we're doing in this moment is learning how to advocate for and with the people who need the support. Because the biggest problem, and we kind of said it this entire time, is understanding that people feel that they're already not being heard, right? So if you don't feel heard, you don't feel seen, why would you speak up? But that's why we do. I'm sorry, I'm
I agree.
chatty
And then
Cathy.
it's also about like even having like the capacity. Like I know for a fact when you're pregnant and you're becoming a new mother, like there's so many different thoughts running through your head. And most of us, like I know personally me, I didn't have the capacity at the time. You know, I really didn't have the capacity to fight for myself. And, you know, as far as me having a doula, you know, as far as her schedule, she was only able to come, you know, once in a while to my doctor visits. So I just love what you're doing with your platform, and definitely encouraging women to advocate for themselves. It's so important. And going back in time, I really wish that I would have just had more of a support group to let me know, like, hey, this isn't right, or just had that support that's like, you know, this isn't going down, like this isn't right, we need to do this, we need to do that, or I don't like, you know, the manner in which you said that. At the time I was really just focusing on having a baby, I was working, so I really didn't have the capacity, you know, to advocate. So I love what you're doing with your platform. It's definitely something that has to be talked about, it has to be highlighted. And anytime like someone close to me, a friend or a family gets pregnant, I definitely make sure that I share with them my story, just to let them know like red flags, and telling them my experience. So that's how I've really been trying to just spread my word and spread my message.
You ladies are holding the discussion down. I appreciate you all. Let me tell you, I was on the road listening. I was on the YouTube stream, and I was listening to all of the great information you guys were providing. And it's just been awesome. And just hearing how people in the chat, I see our chat is just bling, bling, bling. People are involved in the conversation. People are engaging in a conversation. And I just so appreciate you all. What are there anything from anyone else in the chat? Anybody want to feel free to come on video? Or if you don't want to come on video, you can unmute your mic and you can also ask a question too as well. Jay, I heard you monitoring the chat and taking, you know, questions from the chat. Anything you all can fill me in on, catch me up on in terms of the behavioral health piece? So the question that I asked was, how can, and you guys may have already answered this, but how can, you know, mental health professionals such as myself, how can we be of assistance? Like, where do you all think that would best fit? Is it, you know, because not everyone has a traumatic childbirth, but, you know, postpartum depression is real. You know, anxiety, depression, post-traumatic stress disorder after experiencing something traumatic is very real. Where do you all see mental health professionals kind of joining in the movement and helping to support?
So I was telling everyone that I am lucky enough to work on a team with a doula who informs me and is looking out for those red flags for postpartum depression with mom. Another great place to be is I used to work with a pediatrician who would do a postpartum screening, like the first 3 months that mom was coming in for baby's checkups, and would connect mom to a mental health professional. So even educating in those spaces is important. So where are the parents going? Like, where can we have these little assessments or ask those questions to see what's coming up for this new family?
Oh, that's excellent. Yes, thank you so much for sharing that, because in primary care, thank goodness behavioral health is being integrated. So, you know, hopefully you guys noticed, but maybe you didn't. When you go in for your annual and the physician says, "Oh, how are you feeling?" They're asking you depression and anxiety symptoms. You know, if you're being abused or if you're feeling suicidal, those are brief behavioral health screenings that would alert them to refer you. So that is so awesome. I'm reading in a chat, Marnie, you know, you're saying they have no bereavement training, their education is so incomplete. So Marnie, I think you're speaking of doulas maybe, but licensed professional counselors, mental health professionals definitely have training in grief and loss. So the grief and loss and the bereavement that comes along with miscarrying a baby, the post-traumatic stress disorder, there are licensed professionals out there who specialize in women's issues, such as myself, who want to help, can help. Oh, okay. Marnie wasn't referring to the doulist. She was actually referring to obstetricians. So it's good to know that there is a referral system, a support system where women can be referred. But, I'm also thinking of the women that suffer in silence.
Mm-hmm.
The people who go-getters like Unique, who said, let me hook myself up with the counselor. Like Unique, thank God you had the wherewithal. Like I heard you say, like you didn't have the capacity. You wish you could do something different. And when you don't have the capacity, it is hard. But you have the capacity to reach out for help, Unique. And let me tell you, that is so awesome, because one of the things that Black women have such a hard time doing, and my colleague and I, Dr. Bernice Kennedy, we developed a model. It's called the multifaceted model of depression in African American women. And one of the things with this strong Black woman archetype thing that we have going on in our Black community is that we have a hard time asking for help. We have a hard time seeking support. And a lot of times when many, not all, but many, when many Black women do, it's when they are at their wits' end. It's when they are running on E, when they feel like they just can't take it anymore. So I want to highlight the fact, Unique, that it's so important that you actually reached out for help. And even though you felt like you didn't have the capacity, you found it somewhere inside of yourself to reach out and get help for yourself. Thank God for, practitioners like Kyra and Melanated Moms, Jay Wilson, where, there's organizations where moms can reach out for help. But I just want to encourage anybody who's listening, if you could just reach out and ask for help. You do not have to do this alone. You do not have to try to carry this burden. You have nothing to prove to anyone. You don't have to prove that you're strong and that you can do it. You know what? Because some people think that reaching out for help is a sign of weakness. Actually, reaching out for help is a sign of strength.
Yes, it is a sign of strength. Yes, it is. Definitely. Just to be in the space to be vulnerable with somebody. A lot of people don't understand, but to be able to cry in front of people takes strength. A lot of things that people associate with weakness, I associate with strength, just to be that transparent with yourself, like, okay, look, I need help, right? Humbling yourself to go ahead and get the help and reach out to people and let people know how you've been feeling. Because a lot of people are emotionally secretive, or to themselves, they have a hard time being transparent. Right. So yeah, it definitely does take a lot to advocate for yourself, but it's always like that final push, right? Like, okay, things are not right and I need to get the help for it, right? So I definitely agree, Chalice. It's definitely important for women to advocate for themselves when they're not feeling their best selves.
Yes. Thank you all so much. So as we bring this excellent, awesome, impactful human rights crisis Black maternal health discussion to a close on Martin Luther King Jr. Day, is there any final comments? Any last little tidbit of information we want to share before we end our discussion, ladies?
One thing that I would love to share is remembering that you have a voice and choice in this situation when it comes to birthing. Entering a space that you feel will be cared for is important. And if you feel any wrong energy, like I know Uniquely said the energy was off, it's important to find a place where you feel safe, because that's a basic right. And where you feel you will be provided the best care given your situation. So as hard as it may be, remember you have a voice and choice in this situation, regardless of what you're being told.
Thank you, Kyra.
I just want to share one thing that I've learned personally and just through this work is we are all advocates, whether or not we believe it or not. I think a pregnant person doesn't even realize how powerful they are in their advocacy. They're literally doing it as they grow their baby. Pregnancy is a form of advocacy. You're changing the circumstances around you. You're learning more about how to create a better opportunity and a better, safer world for you to bring this new person into this world, right? And that takes understanding that this is greater than yourself, and that's really what advocacy is understanding that even if you are not directly affected by the change that you're trying to make immediately, it's going to create a legacy. It's going to create a different opportunity so that the next person that comes behind you, or the next generation that comes behind you, will have it a little bit easier, or will have a little bit more information so that it doesn't affect them in the same way. So I'm just really glad to continue to be a part of this conversation. And thank you so much, Dr. Chalice, for really putting us in this space so we can just do this. If anybody have any other questions, you know how to reach me.
I love it. Thank you so much, Jay.
And my final thoughts is definitely looking back, some things I would have done different was just to not allow doctors to intimidate me, not allow doctors to gaslight me, and to definitely speak up for myself. So moving forward, when I do get the opportunity to share my story and to experience other women who are pregnant or looking to give birth, I would definitely mention to them, make sure that you stand up for yourself, trust your inner being, trust your intuition, your discernment. And if you feel like something isn't right, please do not hesitate on advocating for yourself or finding the resources or that support that you need to advocate yourself, because this is a big thing. This is your life that we're talking about. This is your baby's life. So I would definitely, looking back in time, of course, I would have definitely stood up for myself more and definitely seeked out more resources as far as with support. But, we live and we learn.
Yes. And do not be hard on yourself. Have self-compassion on yourself. Don't be so hard on yourself, because listen, you were doing the best that you could do with the information and the capacity and the knowledge that you had at the time.
Yes, absolutely.
Yes, well, thank you so much for joining. Thank you for everyone being so lively in the chat and asking questions and joining in, making our discussion so robust. I really hope that this discussion can really help someone, and let's keep it going. Let's not stop here.
Absolutely.
All right, everyone, have a great night.
Thank you. Have a great night, ladies. Thank you.